Do you believe that vaccines are safe and effective? Do you believe that everyone should be vaccinated? Do you believe that the government should mandate vaccinations? Do you believe in freedom? Before we go any further, I would like to say that this video is not anti-vaccine, but it is pro-freedom. As human beings, we have certain inalienable rights. One of those rights should be the right to choose what medical procedures we wish to have. In different parts of the country, there have been a number of bills introduced that would require all children to be vaccinated if they are going to attend public school. Right now, there are religious exemptions that people can claim if they wish to opt out of vaccinations. But the bills that have been introduced would do away with these exemptions. Now, some people may be thinking, that's a good thing. Children should be vaccinated, because if they aren't, they're putting other children in danger. However, arguing that all children should be vaccinated, and that it's a good thing if the government mandates vaccinations, presents a couple of problems. One is that despite what the government and big pharmaceutical companies would like you to believe, vaccines are not 100% safe and effective. The other big problem is that allowing the government to mandate medical procedures is a violation of a person's sovereignty. How much of your liberty are you willing to surrender for the greater good of getting everyone vaccinated? Let's talk for a minute about vaccine safety and effectiveness. You could argue that vaccines have prevented diseases and helped save millions of lives. You could also argue, however, that vaccines are not 100% safe and effective, and that in some cases, vaccines have been responsible for causing severe medical problems in some patients. There is plenty of evidence showing that vaccines are not 100% effective. In many cases, vaccines never take in the first place, and even if the vaccine does establish some level of immunity, the effects of the vaccine wane over time. And when someone gets vaccinated, they may shed the virus and possibly spread the disease for several weeks after they've been vaccinated. In 2011, there was a measles outbreak in New York City. The outbreak was eventually traced back to a 22-year-old theater employee who had been vaccinated. Despite being vaccinated, this young woman contracted the disease and spread it to others. Now that we know that measles can be contracted and transmitted by fully vaccinated individuals, it's safe to say that the measles vaccine is not 100% effective. A lot of people would also argue that it's not 100% safe either. There are countless parents on record saying that their children, who were perfectly healthy before getting vaccinated, started rapidly developing serious medical problems within a very short time after being vaccinated. Here are just a few examples. This website has a story from a mother who says that her daughter contracted the measles from her MMR vaccine. There is a story of a girl who lost half her brain after receiving the MMR vaccine. And this one website has dozens of stories from parents saying that their previously healthy children became autistic after getting vaccinated. There's just one heartbreaking story after another. With the passage of the National Childhood Vaccine Injury Act of 1986, the government acknowledged that vaccine injuries are real. Sadly, this law is a no-fault system that relieves the pharmaceutical companies of any liability, and 2 out of 3 patients who apply for compensation under this law have been denied compensation. Parents who were hesitant to vaccinate their children even said that they were told that if they refused to vaccinate, child services would get involved. Basically, parents were threatened with having their children taken away if they chose not to vaccinate. These are sad stories, but of course correlation does not equal causation. However, there are so many stories of kids having serious issues right after being vaccinated that further studies are certainly needed. And the studies need to be conducted by an unbiased third party that is not profiting from the sale of vaccines. Now let's put all of that aside for a moment. If you have no doubt that vaccines are safe and effective, and you aren't the slightest bit worried about any possible ill effects, is an individual's right to choose trumped by the greater good of public health? If so, then should we make vaccinations mandatory? Consider what that line of thinking could lead to. We know that obesity leads to diabetes, heart disease, and a number of other chronic health problems. Should the government start mandating that people get lap band surgery to get their weight under control? Sexually transmitted diseases are responsible for millions of dollars in medical costs every year. Maybe the government should tell us who we can have relations with and when we can have them. Should the government be able to sterilize people who have a genetic predisposition to certain diseases to prevent them from having children who might develop medical problems? Mandated vaccinations is not just a public health issue, it's a question of freedom, liberty, and the right to choose. And if you think that the slippery slope argument is some sort of logical fallacy, consider the fact that we are already allowing our freedoms to be chipped away. We have border patrol checkpoints that are up to 100 miles away from the nearest border. The NSA can spy on you without a warrant or probable cause. The Patriot Act allows the government to detain people indefinitely without due process. These are just a few examples. Our country has changed and we are not as free as we once were. According to Article 4, Section 4 of the U.S. Constitution, America's form of government is that of a republic. We are no longer a republic. We have become a democracy. What's the difference? A republic is a form of government that is based on natural law principles. In a republic, the majority may not legislate away an individual's rights. A democracy is a form of government based on majority rule and collective rights. A democratic majority is able to vote away an individual's rights for the greater good. If we keep voting away our individual rights, our free society will turn into a totalitarian, tyrannical society. Now, I'm not saying that making vaccines mandatory is going to cause the United States to become a dictatorship in a few short years, but we have to draw the line somewhere and we can't keep letting our rights be stripped away. Mandatory medical procedures are not only an issue of liberty and freedom, it's also an issue of medical ethics. Dr. Lee Heeb, an orthopedic surgeon and the former president of the Association of American Physicians and Surgeons, wrote a column for WND.com warning about how vaccine hysteria could spark a totalitarian nightmare if the government attempts to forcibly vaccinate people. She argued that parents and patients should have the freedom to choose whether to vaccinate their children. Dr. Heeb says medical ethics are clear. No one should be forced to undergo a medical treatment without informed consent and without their agreement to the treatment. She added that vaccination is a medical treatment with risks, including death. It is totally antithetical to all ethics in medicine to mandate that risk to others. If you value your freedom and you want to be able to make your own choices when it comes to medical treatment for you and your family, contact your elected representatives and voice your concerns. Make your voice heard and tell your representatives that they cannot take away our right to choose.